In Washington, there's a huge fight brewing over healthcare subsidies that are set to expire. And what happens next? Well, it could completely upend the monthly budget for literally millions of Americans. So let's get right into it.
114%. This number is really at the heart of the entire thing. It's the average premium increase that millions of people on the ACA marketplace are staring down if Congress doesn't act. I mean, we're talking about their costs more than doubling almost overnight. So how on earth did we get to this cliff's edge?
All right, here's our roadmap. We're going to break down this premium shock that's coming, look at the two deadlines that are colliding in Washington, unpack the political blame game, see who really ends up paying the price for all this, and then explore, what are the possible ways out of this mess? Okay, first up, let's really get a handle on what's causing this potential financial bomb to go off. What exactly is about to disappear, and why does it matter so much?
So it all boils down to something called enhanced premium tax credits. You can just think of them as extra financial help, big discounts really, that made health insurance way more affordable for a lot of people. And the impact? It was massive. Enrollment on the ACA marketplace shot up to a record-breaking 24 million people.
The numbers here really speak for themselves. The average person getting these subsidies pays around $888 a year for their premium. But without them, that's expected to rocket up to over $1,900. That's an extra $1,000 a year, just vanished from family budgets. And for about 1.6 million people, it's actually even more terrifying. We're talking about middle-income folks here, maybe small business owners, people who retired a little early. They were helped for the first time by these new credits. But if the credits expire, they fall right off what's known as the subsidy cliff, and boom, all their financial help is just gone. So how did this financial problem turn into a full-blown political perfect storm? Well, this wasn't just some isolated debate about healthcare. It got tangled up with the biggest, most high-stakes deadline there is in Washington, a government shutdown. This timeline really shows the collision course they were on. You see, the government needed money by September 30th. But just a month later, bam, November 1st is when open enrollment for healthcare starts. The subsidies themselves don't technically run out till the end of the year, but this timing, it created the perfect political battlefield.
Right, so this is the key. The law might expire on December 31st, but the real deadline, the one that affects you and me, is November 1st. If Congress waits past that date, millions of Americans are going to open their mail to find sticker shock notices with these astronomical new costs. That moment of panic and confusion, that's what strategists call the operational trigger.
And you know what happens when the stakes get this high? Both parties immediately dug in, each one determined to make sure the other side got blamed for either shutting down the government or jacking up everyone's healthcare costs. So you basically had two totally opposite game plans. The source materials show that Democrats framed this as them defending working families. They accused Republicans of holding the government hostage to get what they wanted. Republicans, on the other hand, argued for what they called fiscal responsibility. Their plan was, let's pass a clean funding bill first, and then we can have a separate conversation about healthcare later. Now, a big piece of the Democratic strategy was to draw this contrast right here. They pointed out that making these ACA subsidies permanent would cost about $350 billion over a decade, and then they'd put that right next to the projected $4 trillion cost of making the 2017 tax cuts permanent. Their argument was that this contrast says everything about fiscal priorities.
This quote from Senator Amy Klobuchar really sums up the Democratic argument on timing. They were pushing back hard on the idea of waiting, basically saying that because of that November 1st enrollment trigger, this was a crisis that had to be solved right now.
And here's the counterpoint from the Republican side. They framed these subsidies not as keeping a program going, but as brand new spending being shoved into a must-pass government funding bill. Their stance was pretty clear. Split these issues apart and stop what they saw as a political power play. Now, the sources we reviewed also pointed to a strategic pivot in the conversation. To change the subject from rising premiums, some Republicans reportedly made claims that fact-checkers called misleading. The claims suggested that Democratic plans were actually a way to fund health care for undocumented immigrants. And just like that, the debate shifted from premiums to the very charged issue of immigration. So with all this political chess being played in D.C., who actually pays the price? Let's zoom out and look at the real-world impact this has on American families and individual states. The projections are just grim. Policy analysts estimate that if these subsidies go away, nearly 5 million people will become uninsured in 2026. Not because they don't want insurance, but simply because they won't be able to afford it anymore.
And this pain would not be spread out evenly, not even close. Look at this chart. It shows the projected jump in the uninsured population for just a few states. In Mississippi, it could shoot up by a staggering 65%. States like Georgia and South Carolina would also get hit incredibly hard, which would create enormous problems for their entire healthcare systems.
And when you drill down, you see specific groups of people who are just incredibly vulnerable. We're talking about rural Americans who could see their premiums go up by over 100%, and those small business owners and early retirees we talked about. They're the ones facing that subsidy cliff, where their costs could jump by thousands, even tens of thousands of dollars a year.
And here's where it gets really interesting, politically speaking. The data shows that a majority of the people who rely on the ACA marketplace, 56% of them, in fact, live in congressional districts that are represented by Republicans. So the very people who would be hurt the most by letting these subsidies expire are the constituents of the party that has been blocking the extension. It's a real paradox.
Okay, so with this crazy political standoff and such severe consequences hanging in the balance, is there any way out of this? Let's take a look at how this could all end.
One of the most surprising things that came up in the source material is something called the awareness gap. You would think an issue this big would be front-page news, right? Well, polls actually show that most of the public, even many of the people who would be directly affected, have heard little to nothing about it. And that lack of public outcry, well, it takes a lot of the pressure off lawmakers to actually find a solution.
Given all the bad blood and political distrust, a permanent solution just doesn't seem to be in the cards right now. Most analysts think the most likely outcome is some kind of temporary fix, an extension for maybe 1 or 2 years. It's a compromise that avoids that immediate sticker shock before an election, but it really just kicks the can down the road.
And really, that leaves us with the million-dollar question, doesn't it? These constant last-minute fixes create so much uncertainty for families who are just trying to plan their lives, and for insurance companies trying to set fair prices. It really makes you wonder, beyond all the partisan fighting, what is it actually going to take to find a stable, permanent solution for healthcare affordability in this country?